Hello, friends, and welcome to episode 692 of the Juicebox Podcast. Kim from episode 443 is back. 443, and today is what, 692? You're probably thinking that was like 1,000 years ago, Scott. 1,000 years. It was actually February 2021. But, hey, I'm a prolific podcaster, so the number grows quickly. Anyway, Kim was here in 443 to talk about her daughter's story and to share a bunch of information about some diabetes clinical trials with us. And she is back today to talk about another trial, this time with the inhaled insulin Afrezza. While you're listening, please remember that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. If you're a U.S. resident who has type 1 diabetes or is the caregiver of someone with type 1, please go to t1dexchange.org/juicebox. Join the registry, take the survey, help people living with type 1 diabetes while you're supporting the Juicebox Podcast. t1dexchange.org/juicebox. This episode of the Juicebox Podcast is sponsored by the Dexcom G6 continuous glucose monitor. You can learn more about the Dexcom G6 or get started with it right now at dexcom.com/juicebox. The podcast is also sponsored by Omnipod. That's the company that makes those tubeless insulin pumps, the Omnipod DASH and the Omnipod 5. That one's got an algorithm in it. If you want to learn more about them, you're going to go to omnipod.com/juicebox. I just got my license retaken. So if you listen to the podcast,
yeah.
By the way, we're recording, just so you know. And
sounds good.
I had that very low iron problem for a long time.
Yeah.
And so I had a photo of my driver's license where I looked like someone hit me with 3 cars and then stood me up and went, smile. Like I really look sick in it. And so when
they try to make you happy at the DMV. So that's surprising.
I look back now and see that I did not feel well. And anyway, so I get the thing in the mail and they're like, look, you can just renew online. I'm like, oh no, I'll take the new picture, please. And so I go down there, I put this whole effort into it and I stand in front of the woman and she goes, great. And I'm like, why is the camera like at my nipples pointing up? I'm like, Kim, I don't have that kind of face. You know what I mean? Like not many of us do. Maybe I can shoot Brad Pitt from the floor, but I don't know who else. You know what I mean?
And make you look really tall.
I said to her, I was like, can I crouch down so this thing's more at eye level with me? She goes, please do not. And I was like, oh, all right. So I got back a slightly better photograph. At least I'm not sick anymore, but I still, Kim, my head's too big for this kind of photography. Do you know what I mean? Like,
well, is that the photo that I'm seeing of you now? Because you look perfectly handsome there. No, but that's not at the DMV. That's outside.
That's me holding the phone 12 feet over my head to take that picture.
Oh, other angle. Okay.
I threw the phone up in the air. That's how much higher it is than me.
Yeah. No, because it looks good.
Well, thank you. But generally speaking, we should not be shooting people from the ground up. It's not a great idea. 4 people that look good that way, and they're all 23 years old, by the way, too.
The DMV is there to provide you, the ultimate in customer service. So
listen, it's still 1,000% better than it was. So
see, I do understand sarcasm.
Well, I don't see a ton of reason for me to be sarcastic in this episode, which, by the way, I've been excited about. So I appreciate you doing this for me. Just do me this favor, unless you have any questions. Just introduce yourself very quickly.
I'm Kim, and I am, the mom of a type 1 diabetic who is 16, who was diagnosed when she was 13 on her next to last day of 7th grade. And after my daughter was diagnosed, her name is Nina. After she was diagnosed, I found out about JDRF and wanted to do what I could to help. So I joined the board of JDRF Northern California, and my job specifically is as a clinical trial education volunteer to make sure people get connected with clinical trials that might benefit them and benefit diabetes research.
All right. So, Kim, have you been on the show before?
I have. I was on the show about a year ago, and you did an interview with me just talking about the process of joining a clinical trial and about all the clinical trials that were available to people at the time.
Right. And I do remember, I brought that up so I could ask if you knew what episode number it was.
Oh, I don't. Oh, okay. I should.
Don't worry.
I don't remember. And I do remember you said, if there's ever a clinical trial that you're excited about and you want to share with people, please come back on for a few minutes. So that's why I reached out to you again.
No, absolutely. Listen, it's my job to know what episode you're on. I just thought like I could get away with it if you were like, oh, I know. I was like, great.
No.
Do you think that what we spoke about in that last episode, is that still applicable today, or was that time sensitive?
So some of it was time sensitive because at the time there was the teplizumab PROTECT trial. There was the CLEVER trial, which was verapamil and closed loop systems, both trials for newly diagnosed patients. And happily, those trials have gotten enough participants. And so they are no longer recruiting, which is wonderful, because one of the reasons I took this role is because I learned that so many clinical trials don't get enough participants, which is such a big waste of money and halts progress towards, better management and cures. So a few of the trials we talked about back then are full, but I think we talked a lot just about clinical trials in general. So I don't think it's, completely out of date.
Yeah. It's hard to get people to do these things. And it's understandable why it's difficult, but to your point, like they have these trials and they're like, look, we need X amount of people to do this. And if they don't get that many people, then the study doesn't happen.
Yeah.
And it's not, there was a lady on maybe 2 months ago or so who was in the, which trial was it? The implantable cells.
But the Vertex or ViaCyte?
Yeah, the ViaCyte stuff, right?
Yeah.
And, she's an older person with, not she wasn't older, but, she's a middle-aged person who has type 1. It's not going to benefit her, you know what I mean? And she still put herself through it, even in a double-blind study where she wasn't even sure if she was even going to get the real thing or not.
Right.
And she still let people like surgically implant pouches under her skin. I just thought that was so amazing.
Yeah, I met another gentleman who did that study, and and I do, hopefully I'm middle-aged too. Hopefully we still have lots of years to enjoy with or without insulin. But I met a gentleman who did that study as well with the implantable pouches from ViaCyte. He had 2 kids who were type 1, so I think he was very motivated
for that reason.
In that regard too.
Yeah. Okay. So, is the thing about the thing, we're gonna be trying to talk right, it's gonna be in the title. Like, why am I acting like people who are listening like, I wonder what's coming next? That was the stupidest thing I've ever done. Your daughter's using, all right, first of all, I might say it wrong, is it Afrezza?
You said it perfectly.
Oh, okay. Look at me.
Yeah.
When did she start using it?
So she's actually using Loop. So she has a pump and a Dexcom. So she's not exclusively using Afrezza. She's still using her Humalog. Well, actually, she tries a lot of different things. So at the moment, she has a mix of Liamjev and Humalog in her pump, and she's a clinical trial herself. So she's trying that out. But she started using Afrezza in addition to Loop, I'd say probably about 9 months ago.
Okay, so let's start slow. She's mixing 2 insulins in her pump. Is that something she's doing on her own?
Well, with my blessing and
I'm just saying it's not she's not in some sort of a trial is what I'm saying.
No,
right.
She's not in a trial.
Right.
I think I think Arden did this too. She tried Fiasp and loved it until she hated it because it worked, and then I guess it stopped working after a while. And so she had heard that mixing it helped, but that worked for a little bit while longer. And then we both had heard that Liamjev might work a little better in a pump than Fiasp. So she's trying that out now. And someone gave us the vial to try it.
So with Arden, it was is it Fiasp? Fiasp?
Yeah.
I don't know.
Fiasp.
Right,
yeah.
whatever.
I think Fiasp.
All right. Well, whatever. And it's It's the one from Novo Nordisk, right?
Yeah.
It worked terrific for her. Burned when she injected it.
Oh, okay.
Yeah. So then we actually did try the Lumjev afterwards, and that was worse. So for Arden,
okay.
so we didn't do either, but we loved how how that worked for her. The onset to working was amazing, and it didn't give up. She powered through. So that one wasn't terrible. The burning, Arden stayed on that a month or so, if I'm remembering correctly, and we had great results with it. The Lumjev, she made me take off inside of 24 hours.
Oh, it burned that badly.
Yeah, she's like, I gotta get this pot off, and I was like, okay. So
that's too bad.
So I thought your daughter might be mixing it to try to cut down on the burning, but she was trying to get it to work the way it was working when she first used it.
Yeah, I guess the additive that they put in both of those, maybe that's what causes the burning for Arden. But it also, I think, sometimes can cause maybe a little bit of, I don't know, some kind of buildup or something where it just doesn't work as well over time. So yeah, she's just hoping that mixing it will help it work better and longer. And this is relevant to Afrezza because, right, these are all faster acting insulins.
Yeah.
And these are, and they work great. And they work, so when they don't hurt. Yeah.
So let's go over Afrezza for a second. Like it's inhalable.
Yes.
It comes only in certain measurements, I know, but I'm not sure which ones.
Yeah.
How did your daughter, did she ask her doctor about it and they gave her some, or where did she get it from?
Yeah. So, and what I'm going to talk about today is the clinical trial for pediatrics, and she's 16, so still falls in that. Somebody that I met said, this is really great. Do you want to try it? And had some extra. So, that's how she ended up trying it. And it was game changing. She uses it when because she's on the pump with Loop, she's sort of fairly well managed with that.
Right.
But the Afrezza, she uses primarily if she's high or stuck high, although she's never stuck high anymore because of Afrezza. So she'll use it if there's no opportunity to pre-bolus, which, she's a gymnast and a high school student. And so there's lots of times when it's hard to pre-bolus. So she can use it for that. But she also uses it, let's say a pump fails or hormones or sickness or whatever myriad of things leave you over 200 once in a while. She will use the Afrezza to bring it down. And it's like, boom, like I guess the insulin action time of Afrezza is 12 minutes compared to, I guess, over 30 for insulins like Humalog. So she's never stuck high because as soon as she's high, she takes an Afrezza and it brings her down and then it's out of your system. So it really closely mirrors insulin production in a non-diabetic. So it is in quickly, but it's also out quickly. So it tends to just go down to where she wants it to go down and, takes some figuring out what dose you need. But it goes down to where she wants it to go down and then it's out of her system. So she doesn't go low with it. Yeah. It's out in like an hour.
Right. So everybody that I've heard talk about, and there are people I'm online that are just, they're fervent about it. If it comes up, it's, they're almost like, let me tell you about Jesus. You know what I mean? They really
people who use it do love it.
Yeah.
It is kind of magic.
Right. And so, I mean, for me, again, not a doctor, don't know what I'm talking about, but I'm on Afrezza.com right now. And the label warnings for this scare me differently than other things.
Yeah.
And so I know we're not going to try it, but I don't want to not hear about other people's experience. So, for an example, if your daughter was to miss on a bolus, just forget to bolus something, and suddenly had like a 300 blood sugar, 45 minutes after she's like, oh my God, I didn't eat them. My blood sugar's 300. She would like take a puff of this Afrezza, and how long to break that 300 and bring it back? I do love a cliffhanger for the ad break. Dexcom, let's talk about them first. Dexcom.com/Juicebox, a continuous glucose monitoring system, CGM. That's what the Dexcom is. Tells you your blood sugar in real time on your Dexcom receiver or on your iPhone or Android. It's that easy. I'm actually Working on getting a blood sugar down for Arden right now. And, ooh, this is interesting. So 20 minutes ago or so, we made a bolus to try to move a 166 blood sugar. And I've opened my phone now to see that her blood sugar is still stable. Like the arrow's telling me it's stable, but it's beginning to drift down. We have a new number of 161. What that tells me, because I've been using Dexcom for a while, the number's moving, but the arrow hasn't moved yet. So it's probably going to, maybe in the next reading or so, indicate to me with a diagonal down arrow that her blood sugar is moving. So think about this. Not only can you see the numbers, but you can see the direction that the number is moving in. And the arrows also tell you about speed. Arrow straight down is moving faster than an arrow diagonal down. 2 arrows down moves faster than both of them, etc. You'll see if you get the Dexcom. What am I saying? If. When you get the Dexcom, you'll see how all this works. It's the speed and direction and number of your blood sugar at the touch of a button at your fingertips. Swipe up. There it is. Dexcom.com/juicebox. Now let's talk about that Omnipod 5 and the Omnipod DASH. Here's a couple of things you need to know. Omnipod is a tubeless insulin pump. My daughter's been wearing it since she was 4. She's going to be 18 soon. She's had one on every day, and that time, we love it. I think you might too. Here's how you find out. You go to omnipod.com/juicebox. Some of you are going to be eligible for a free 30-day trial of the Omnipod DASH. That's pretty amazing. Go check that out. Some of you might just say, hey, I'm going to jump right into the algorithm. Give me that Omnipod 5. That's another thing you could possibly do. These things that you can do, they happen at omnipod.com/juicebox. Head over there now and find out more. Tubeless insulin pumping means you can shower with your pump on, swim in a lake, jump out of an airplane. You could, I don't know why you would do that, but you could. Because there's no tubes to get caught on. Like, can you imagine if you were like pulling your parachute and instead you pulled out your tubing? That'd be terrible. Omnipod, no tubing. Here's a promise I can make you right now. If while skydiving, you reach and grab, you will never grab tubing from your Omnipod tubeless insulin pump because it doesn't have it. Sure, this is not a situation that's going to come up often, but, if you're plummeting from the sky and looking for a parachute, it's pretty cool to know that you're not going to mistake your insulin pump tubing for that parachute. This is a reach here, but I've gotten a little farcical. We're at the end now. I feel bad about this. Omnipod.com/juicebox. Find out about the Omnipod DASH, the Omnipod 5. See if you're eligible for that free 30-day supply of the Omnipod DASH. I just have to tell you now, for full safety, risk information, and free trial terms and conditions, visit omnipod.com/juicebox.
So the higher you are, the more you need, right? Like you're becoming more
resistant.
More resistant. Yeah. And, bless her heart, she doesn't miss a bolus. So I don't know exactly, but there was a scenario where she had a pump fail and it was overnight. Mm-hmm. So no one really recognized it for a while. And so she was floating up around like over 250. And so I went in and, brought her an 8-unit Afrezza cartridge, and she took it. And in 15 minutes, she was back, in the mid hundreds, maybe 140.
Doesn't get low afterwards?
No, it doesn't. And obviously you need to figure out the dosing. If she had done like a 16-unit cartridge, which we don't even have, maybe she would have gone low.
Sure.
But it doesn't go low because it goes out quickly. So, usually, right, if you have a pump failure, you don't know how much insulin you actually have on board, right? So you might over bolus but with the Afrezza, she does the Afrezza and it's in, it brings it down, but then it's out. And so she doesn't tend to go low with the Afrezza the way she might if she was stacking insulin, not really knowing how much insulin was on board with something like a pump fail.
How long would you say it stays in the body? Like, when do you stop seeing an effect from it, even in a regular situation?
They say it's an hour and a half to 2 hours that it's in the body. So, it's in within 12 minutes and then it stops in about an hour and a half. And sometimes it seems like it's even less than that. And that's that's kind of the beauty of it, because I think when you're in a situation where you're high, sometimes, maybe if you've listened to all of your podcasts, you know exactly how to bring it down right. But I feel like a lot of times when she's stuck too high, we might push it down too low. Not, it's just so hard to manage because you're high for a long time and you're like, wait, I'm still high. Do I give more? But the Afrezza works so fast that you can see, oh, that worked. So now we can stop.
Yeah.
No, and if it starts inching up again, you can just give another hit, maybe a 4-unit Afrezza, and bring it back down again.
Is it hard to figure out? Like, what is it? It's 4 units, 8 units, 12, 16?
Yeah, I think it's 4, 8, and 16. Maybe there's a 12. We just have the 4 and 8 unit ones. And the it's equivalent. It's not actually 4 units, because when I first heard about it, I'm like, oh, she doesn't ever use 4 units, so that's a lot. And it's very different being 16 than 13, so probably she does now. But if she finds the 4 unit, and most people do equivalent to like 2.5 units, so of Humalog. So it seems a little different in terms of what the dosing means.
Yeah. Actually, I'm again on their website. There's a asterisk. It's talking about something, but it indicates there's a 4 unit, a 12 unit cartridge. So, I mean, I know there's 8 and 16 as well, because you're
okay. So there's those 4 different cartridges. Yeah.
So is it basically marketed to people for like mealtime only?
Yes. So it's marketed to people for mealtime, and then they do a long acting shot with it.
Okay. So most people would do a basal insulin injected. Your daughter's actually looping with basal insulin and then doing this for meals and highs, or does she also use the loop for meals?
No, she uses the loop for meals. She just uses this in a situation where maybe she's like at a birthday party and there's a last minute thing that, okay, everybody, we're going to eat this and leave. And so she has she doesn't have to, you don't have to pre-bolus with Afrezza. Like, your food comes at a restaurant, you bolus then. So in a situation where it's really hard to pre-bolus, she might use it, but primarily she uses it for a situation where she's just high and stuck high, and this just brings it down. So maybe, right. There was a situation the other day where she was at a meeting that she had a school thing, and her pump was expiring and she didn't have supplies with her, but the Afrezza is so tiny, she carries that. It's easy. So she had that in her pocket. So even though her pump was done, she just did some Afrezza, made it until she got home 3 hours later, and her blood sugar was perfect. So she uses it more in those situations. So, maybe a couple times a week, but it is marketed as a mealtime insulin. But because we love loop, she's kind of using both.
Doing that as well. I was going to ask you about how frequently do you think she's using it, but a couple times a week.
Yeah. Yeah.
Is it cutting down on lows on the other side of highs for you, as well as limiting the amount of time that she ends up spiked?
I think when she uses it, she doesn't go low. Because of loop suspending insulin, she doesn't go low that often. But she's also a competitive gymnast, so that makes just everything hard to manage. So she still has occasional lows, but not from the Afrezza.
Do you ever get confused when she's having an issue, just meaning anything that's out of the norm for you? Is it ever confusing about which insulin's doing it, or does that not matter because you treat this situation the same way?
I think, she's very self-managing, so I'm not even sure I can answer your question. Okay. But I think with the Afrezza, when she does the Afrezza, she doesn't do anything to loop. So it tends to suspend because it sees that she's going down really fast. So it's kind of like she's not getting Humalog when she does the Afrezza. So she knows that, hey, if I'm at 210 and I do a 4-unit cartridge of Afrezza, that's going to bring me to 120 steady. And it doesn't seem to be confounded by the Humalog. And I think it's because the insulin action of the Humalog is so much longer, that even if she has some insulin on board, it's okay. But I think, she takes that into account too. Like, she's like, look, I have 8 units on board because I've been, my pumps, my loop's been trying to push down this high. She might do a smaller dose of Afrezza.
Okay. So let me ask you, how much input? So did she come to you with this idea, or did you go to her with it?
Oh, a third party came to us. A friend was like, you should try this. Okay. It's a great tool to have in your arsenal. And she's like, yeah, because, she wants to be well managed. She hates to have high blood sugar. So she was just gung-ho about trying it.
Yeah. Did you look into the safety data about it before you let her do it, or did you just try it, or what did you do?
Oh, yeah. I read everything. I mean, this is, part of the reason I like this role of educating people about clinical trials, because I want to know all the details. Right. It's like every drug, all the research that's happening. I'm obsessive about it. So yeah, I looked into it, read the history of inhaled insulins, which is really fascinating. Like, right after the discovery of insulin, they started working on an inhaled insulin. It just took a really long time.
In the 20s, they started on it?
Yeah, in the 20s in Germany, I guess they started working on an inhaled insulin.
Interesting.
It's crazy. It took so long. And then this insulin called Exubera came out maybe in the early 2000s. But it failed for a few reasons. I think primarily because they had this huge device. It kind of looked like a bong to inhale. I couldn't carry it around. Although I am waiting for my daughter to get busted for vaping with her Afrezza at school, because now it's like this tiny thing. But anyway,
I have some marketing materials from Exubera. It's Exubera, and my goodness, it looks like a flashlight. Like that size, like a big flashlight, and the girl's like, it looks like a bong, basically. Yeah. Okay. It does.
I think Afrezza maybe did a little more consumer research, or maybe things evolved that they were able to bring the size of that down.
Yeah, the Afrezza always reminds me of a whistle.
Yeah.
When I look at it.
Yeah, it does. It looks like a tiny whistle.
Yeah.
Yeah. Very convenient, very easy to just stick in your pocket. So yeah, I mean, I definitely read, a lot of patients in the adult clinical trial, which, happened, I think it was like 2014, it came on the market, had a cough, and, that could be uncomfortable, but that would tend to go away. And probably the thing that you saw, the warning was, two adults in the adult trial developed lung cancer. But that was 2,750 patient years of data, and the FDA approved it, saying that was no more or less likely to happen in a general population of that many adults. And those two people also had a history of smoking. So, right now my daughter has been prescribed for, painful cycles, birth control. And I'm like investigating all of the different options. And there's something scary about every single one,
No, I understand. I really
try to figure it out and be reasonable and take it into account, but it's hard.
Yeah. No, I listen. I understand that. I mean, drugs in general, I think, make people's lives better when they're used well, and that, like you're saying, that it's not going to work great for everybody. And it's tough though. I mean, it's basically right on the front of their page. It says Afrezza can cause serious side effects, including sudden lung problems. And, don't use if you have long-term chronic lung problems, asthma, chronic obstructive pulmonary disease, etc. See your doctor. But, sudden lung problems, like that's like, I don't know. That's a tough one for me, because are they sudden lung problems that go away if you stop, or are they sudden lung problems that it's sort of the way I feel about getting corrective eye surgery. Yes, I think it would be a great idea, unless I'm one of the people that gets halos, and then I'd like a time machine, please. You know what I mean? Like it's
Absolutely. Yeah.
It's tough. I just wondered how you
And
dealt
I
with it.
think so the way I felt about that, investigating it further, was those sudden problems go away when you stop. So I figured, try it. If it, gives her, sort of bronchospasms or cough that's uncontrollable, then she won't use it anymore.
Mm-hmm.
So she does have mild asthma, but she did a pulmonary lung function test. She had done one earlier just to see if she should take an asthma inhaler or not. But they do recommend that you get that done when you take Afrezza, and then get it done again 6 months later. And in the clinical trial, they will do that for you. So they're keeping an eye out for that and making sure that, your lung function is fine.
Yeah.
But it's evidently something that just goes away when you stop taking it. So if you have a problem, you just stop taking it, and then that cough or the acute bronchospasms go away. Not everybody gets that. And yeah, they do have a warning on it. Don't take this if you have asthma. That said, my daughter does, and she's fine with it. She doesn't even get the cough. And there's a hack. Like if you drink a little water before and after, and you keep it room temperature, you're way less likely to, even get that like mild irritation from inhaling it, but you're inhaling something.
Yeah. Right. Bronchospasm sounds like an awkward dinosaur to me. So
it does, doesn't it? Yeah. And I'm not a doctor, but I think it's just it's an acute thing that, if you let it calm down, it'll go away. It's not.
Right. Is this something that you've noticed? I know she's only been doing it for a short time, but have you seen improvements in her time in range, her A1C, or is everything kind of just the same? You're just managing it differently?
I think there's definite improvements in time in range, because she doesn't stay high for more than, sometimes she might not, take the Afrezza right away, but if she takes it right away, she's not high for more than 15 minutes. So it really gets rid of highs. And again, it doesn't cause lows. So yeah, her time in range is better. I know in the adult clinical study, the time in range, increased 2 hours a day. So I think it can have a huge effect on time in range. I don't know what her A1C is usually in the like high 5s, low 6s. I think it's, not that different, but it's probably a little better since starting Afrezza.
Okay. This is like one of those things where you're looking for a problem, but it's still popping into my mind enough that I'm going to ask. Does the fact that it works so quickly, can it make you ignore that you need insulin? Like, you know what I mean? Can you get too comfortable? I guess it's not that you could ever be too comfortable, but you know what I mean by that. Like, can you get kind of laissez-faire about it because you know how quickly it works? Or have you not noticed that?
That's an interesting question that you might have to ask my daughter.
Yeah. Okay.
Yeah. I don't know.
How old is she again?
I mean, I think she's 16.
Okay.
Yeah. So, I could only imagine that it might not be as terrifying to go high, but it happens though, right? Like go high, whether you want it to or not, you're going to have hormones, you're going to have sickness, you're going to have pump fails, you're going to have temptations or food coming at a restaurant when you didn't know when to pre-bolus. Like these things are just going to happen. So, I don't know whether, it makes her act differently. But when probably not, she's a very, she's always wanted to manage really well. Mm-hmm. So I don't think she's not a laissez-faire kind of kid. But could that happen? I guess so.
Right. No, it's funny. I don't even, as I asked the question, it's not even something I'm wondering about as much as I'm wondering if somebody else would wonder about it. So I just asked it to ask.
Yeah. Yeah. I mean, but then again, it's like loop, like Omnipod 5 or Tandem Control IQ, like these things don't necessarily make your time in range better, although they often do. I think the primary benefit is just giving you your life back and making life easier. And I feel like that's what Afrezza really does, is she's she's not in the middle of an AP test with her blood sugar going up and going, oh, I'm doomed. She's like, oh, I can fix this. It's okay.
Right. No, it really does sound terrific. I've never not thought it didn't sound good when anybody's explained it to me, to be perfectly honest. It's just, I'm just being perfectly honest, like inhaling something unnecessarily seems weird to me, but I don't know. And I know people say, oh, that people have been using it for a decade or longer and, they have data now. And I mean, that's good, but I don't know.
Yeah, it's newer. I mean, people have been in, if you had sort of looked at inhaling versus injecting and they were both as new, you might be like, oh, I'm not going to inject something I don't have to inject. But now we've been doing that for 100 years. So there's more data for sure.
Yeah. Right. Yeah. Right. It just gives you right. Nothing about using a liquid insulin is going to make your lungs stop working. So,
Well, and, I've been inhaling, albuterol for, I don't know, 35 years and steroid inhalers. And so maybe having asthma, I'm really used to inhalers and they've made my life better. So,
sure.
So I'm not, and then the technology is getting better too, right? They can, I don't understand the material science so well, but they can break things down so that they're just doing what they're meant to do now,
The molecule passes easier.
Yeah.
As they refine it.
Yeah. It's tinier. It's, but I just, for me, it's just like, wow, it's just game changing. So I want people who want to try it to have that opportunity. And so I think it's, it has been on the market. People have been doing it for 10 years. It's been approved for adults. And I feel like kids more than adults, need that spontaneity, need to be able to eat without pre-bolusing, need to be able to, bring down highs more quickly. So, as adults, I think, maybe you're more inclined to like, okay, my blood sugar's high. I'm going to go for a walk. I'm going to pre-bolus and eat in 15 minutes. And, my kid wasn't diagnosed till 13. So she was already, managing pretty well, but I just feel for families who have younger kids and I want them to have the opportunity to try this if they want to. So I am telling people about all the clinical trials that are going on, whether it's cure research or device research or insulin research. But this one is one that I'm really passionate about because I've seen how well it works for my daughter. So, so now that they've got the clinical trial for kids and it's a phase 3 trial, so they have tested the safety and they've tested that it works. And so now they're on the phase 3 trial, which is just trying it in a broader population of 4 to 17-year-olds. And I hope it, fills up quickly so it can become available to other kids.
Question about the trial. Do you get the drug through the trial?
Yeah. So the way the trial works, it's a 14-month trial. So it's long. And for the first month, they kind of do some tests, test your A1C, do the pulmonary or the lung function test. And then for the next 6 months, I think they have twice as many people doing the Afrezza as shots, but they have a group doing shots and a group doing Afrezza. And then for the second 6 months, everybody does Afrezza for mealtime insulin. And then there's one more month where they do some follow-up and that's it. So it's 14 months in total. Yeah. And they provide you with the inhalable insulin. They provide you with a free Dexcom for the entire year of the trial.
Fun.
Yeah. And then they also pay you, I think it's around $750 to participate.
Is that still going on? Could people get into it right now?
They could. Yeah. And they have 17 locations throughout the United States. So everywhere from, California, Florida, Indiana, Texas, Tennessee, 17 different locations. So it's all over the US. And you go into the office just a few times. So even if there's not a site like super close, it's still possible to do it. Most of it is done remotely. Like they give you the stuff, they give you the goods and send you home. Mm-hmm. And to find it, I think if people just Google Afrezza and clinicaltrials.gov, they can find it. Also, the name of the study is Inhale 1. So that's another way to find it. But I think just Googling Afrezza, it's AFREZZA, and clinicaltrials.gov or pediatric clinical trial, they'll come up with the study. And then if they scroll down to the bottom of the information about the study, they can see the locations with phone numbers and emails. And so what they'll want to do is contact their local study center, the one closest to their home, and ask about getting into the study, or ask for any clarifying information they might need. I know a tiny bit about many different studies, but those study coordinators know everything about this study. So they're the ones to contact for more information.
Yeah. Excellent. What, are there any other studies that you want to share with people that are happening right now?
Yeah, there's a couple other studies.
I thought if someone would know, it would be you. So
yeah. Let me just pull up my list to see what I think would be most helpful to share. Some of them, I stay really on top of Northern California, but you've talked about this a ton on your podcast, so I don't necessarily need to repeat it, but I think right now it's more important than ever to get loved ones screened for antibodies through TrialNet, or T1 Detect is another way to do it, but TrialNet is free, and trialnet.org is where people can go to find out about how to get test kits sent to their home to screen siblings and other family members to see if they have antibodies that will determine their risk of developing type 1. Mm-hmm. And I think this one's more important than ever because teplizumab, which was in clinical studies last year, is on the cusp of being approved by the FDA and has been shown to prevent the onset of type 1 for 3 years on average. So if you have somebody who is at risk of developing type 1 in your family, I know a lot of people used to be like, oh, do I even want to know? I know I recognize the signs and symptoms, but I think it's always been important to avoid people from getting diagnosed, in DKA or having it get too bad. But now it's even more important to, I think, know that that's available and that you can find out that there is a risk. And I have to say, when my 12-year-old did the TrialNet clinical study, she was really, I think, grateful. She got a little shirt that said, "I'm contributing to science." And I think she was grateful to be able to do something, like feel like she was contributing to her sister's disease. So I didn't mention that, but I'll mention one other clinical trial, but I feel like one of the big benefits to being in a clinical trial like this Afrezza one or any other clinical study, not so much with TrialNet, but is you get a generally kick-ass endocrinologist to stay with you over the course of a study and, give you advice on dosing and other things that you might, need to manage your diabetes better. So just that relationship, it's like having an extra endocrinologist who is really at your side, guiding you through these studies, but also guiding you through your diabetes journey is, I think, a big benefit. And a lot of times these researchers who are what they call principal investigators on these studies are some of the world-renowned endocrinologists. And it's great to have them working with you and answering your questions and learning more from them.
People paying attention to the cutting edge a little bit.
Yeah.
And then there they are, and they're a sounding board if you need them.
Yeah.
Oh, that's interesting.
Yeah. So the one other study I'll mention is, it's DOMPE. It's DOMPE. And this is the one study that I know of right now that is for people who are recently diagnosed or diagnosed within the last 120 days, which is a little bit better than some of these past trials. They wanted to get you in 3 weeks. And they want that because they're trying to help you preserve the beta cell functionality or the insulin producing cell functionality so that you stay in the honeymoon longer. And there's a lot of benefit to that. So, but DOMPE, DOMPE, is an oral drug that's thought to preserve the beta cell functionality. And it's also offered in a bunch of different locations. So you just have to, again, Google Dompe and clinicaltrials.gov. And I wish this had been around when my daughter was diagnosed, because she's needle phobic. So the idea of doing the studies that were available at the time, which required an infusion of, sitting there with a needle in your arm, were not viable for her.
Right.
But this one is an oral drug that you take at home. So it's 10 steady visits over a year. Like with all these trials, they provide you a Dexcom and then they, give you the pills, and you take this at home, and it can help preserve the honeymoon period and make your diabetes easier to manage for a longer time period. And then I always think like it's great to preserve that, insulin producing cell functionality, because there's other things coming down the road that, maybe can make them work better again. And, I just feel like the more you can do this or stay in that state, the better. So
right.
That's another trial I'd love to share with people.
Cool. Yeah. I know I'm imagining that Temizepam is getting close to something, because they're on my schedule this summer to record.
Oh, good.
Yeah. And, I don't know why they're coming on, but I didn't imagine that they contacted me and said, hey, we'd love to share bad news with you or tell you how we're refurnishing the offices or something like that. So,
well, that's great.
Yeah.
Glad you've got that little hint there.
Yeah. So, they're on.
Yeah, no, I definitely expect that to be news that we hear about soon. So yeah, I guess it's almost summer. So that's, yeah.
You know how like you hear on your favorite radio show, like Robert Pattinson's going to be on, and you think, oh, he must have a movie coming out. Yeah.
That's right.
Something
a book
like
or a movie.
So We'll find out one day. But it is fun to not know anything and sort of know something at the same time, because I really don't know anything. And
yeah.
And then, but they are right there on the schedule. I think in August, maybe, if I'm not mistaken.
Good.
Anyway,
Good.
That's excellent.
Yeah.
Do you ever get tired of this, burned out from it, being involved with these things?
Oh gosh, no. Being involved, first of all, I am so grateful, to work with the people that I work with at JDRF, because they're brilliant. I feel like, just people get involved because they've got loved ones with this disease. And then sometimes they're, they've run companies, they're doctors, they're, the people that I interact with who are all working towards, better management and a cure for type 1. I just feel so blessed to be working with. And I feel lucky that my job is to keep up on what's the cutting edge research in diabetes care.
Yeah.
Because I want to know. And from the minute my daughter was diagnosed, I wanted to know what can we do about this, right? And it's a disease. It's a little bit out of our control, but it's also within our control on a day-to-day basis, and on a let's see what's coming down the pipeline to make this more manageable. And then getting people into these studies I think is really going to make a difference, because we're all like either donating our money or our time or our expertise. And this to me just like leverages all of that, because, a lot of the money is going to this clinical research, but if this clinical research doesn't find the people to participate, then it's more expensive and it takes longer, and we all want this to happen as fast as possible. And it's also right now, it's just so exciting. There is so much going on in terms of both, all these closed loop systems getting approved, and the research on insulins that are going to work faster and better, whether they're inhaled or injectable or in a pump. There's research on, faster insulins, insulin that, is just recognizes when you need it, like glucose responsive insulin. And then this cure research is just, it's at I think we're just at a really exciting time where there's a lot that can happen. And, if people just, focus on working on it, and I want to do whatever I can to make that happen faster. So I feel really constantly just excited by what I'm working on.
It's interesting sometimes when you see someone online, they're like, they should hurry up and do this or this. And then you say, like, have you done, anything like involved with research? No, I'm not doing that. Like, oh, okay. Right. Well, that's why it doesn't go faster.
Yeah. And I'm, like I said, I'm not a scientist. I'm not a doctor. I don't have any background in any of this. So anyone could do this, right? Like, just read about these things and try to understand them and then tell people about them. I feel like in some ways it's almost better, if you can communicate about it in a way that other people understand, because you don't know all the details about the medical, and I think just a lot of people want to do this. Like they want to get involved. Like you talked about that woman who just did this study because you feel like she just wanted to give back.
Yeah.
There's a lot of selfish reasons to be part of studies. Like I said, just, getting to hang out with these top endocrinologists, getting free devices, getting, the latest cutting edge, drugs or devices. Like there's a lot of selfish reasons to be involved in a trial. And then, to just give back and help everybody else that's going through this, I think is something that motivates a lot of people too. Like the way it helped, like, I think it just helped my younger daughter to be a little bit involved. So I think the biggest issue with clinical trials is people they don't know about them. They don't know how to find them. And so I think it's, wonderful that, thank you for having me back on and having the people from, TrialNet and other places on the podcast so that people just can find out about it and then make their own decisions about what they want to do about it.
That really is the case. They just need to be aware and then they can decide what to do. And that's
absolutely.
That's
but that awareness is, I think, a little bit lacking. Like, when my daughter was diagnosed, it wasn't like, let me tell you about all the clinical trials she can participate in. And I kind of would have wanted to know. Like, I feel like we're doing a disservice to people if we don't tell them. But I think a lot of times endocrinologists, either they don't have time or they think, oh, that would be too overwhelming. And I just think we should give people the choice.
Well, to prove your point, I get paid every time somebody signs up to the T1D Exchange survey because it's that hard for them to find people. Like it's so difficult for them to find people that they had to come to me and say, can you please direct people to this thing? Here's the amount of money we can pay you every time somebody finishes the survey.
Wow.
Because that's not, you know what I mean?
Yeah.
That's not what they want to do. They want to keep that money for something else. But instead they're out incentivizing. It's not just me, it's other people too. But,
sure.
And it's just, and so they're not advertisers. So they don't pay me like a set amount of money every week, right? Like I make based on how many people sign up a month. But you'll hear me on every episode say like, if you're a U.S. resident or you're the caregiver of someone with type 1 who's also a U.S. resident, blah, 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 t1dexchange.org/juice. Like, go, it helps people, it helps people, it helps people. Like, in the ways it helps is too almost convoluted. You know what I mean? Like, I just need you to believe it helps people. And you're just filling out a survey. It doesn't even take very long. And still difficult to get people to do it.
Yeah.
Yeah.
And I mean, obviously they're finding it worthwhile in terms of the money they're spending to pay you to send people to this and fill it out. They're benefiting,
I hear, Kim, that the podcast puts people on the survey at a much greater rate than other places do.
Yeah.
But that's not really the point. The point is that someone has to spend money to get people to take a freaking survey because it's that hard to get people to take a survey. And you're talking about like swallowing a pill for 14 months. You're like, you get a free Dexcom. And most people have insurance. They're like, yeah, we kind of get a free Dexcom already. Like, doesn't cost me that much,
Right.
And the people who could probably really use it might never hear about it. To your point again, because doctors don't talk about them. I've never once been told about a trial on a doctor's visit. Never.
Yeah. Yeah. So, no, absolutely.
It's interesting.
Yeah. No, you have to figure out why you'd want to do it. For me, and again, it's my daughter, so it's up to her. It would be, the motivation would really be to get to make her life better. Like she would have done this Afrezza trial, but you have to be, with the Afrezza trial, you have to be on shots for 2 weeks before you do the trial. Mm-hmm. And then there is a group that stays on shots for 6 months. And like I said, my daughter's needle phobic, so this is not a trial for her. Wow. But she loves the Afrezza. She'd be happy to try it for her mealtime insulin for a time period.
I have a question about that. So when the Afrezza trial ends, it's not how she couldn't get it anymore, right? She'll be done getting it, and then she'll have to hope they get it approved for the FDA for her age range so that it can be. Is that right?
Well, I think the benefit of this one, and that does happen. Like you could go through a trial and be like, wait, give it back.
Yeah.
And, eventually it does come. I mean, I have a friend who did the Dexcom G7 trial and was like, oh, can I keep that? But, soon enough.
Yeah. I've heard people talk about it with Omnipod 5. I mean, the woman who was on talking about the VitaSite, it's double blind. You don't know if you got the medication or not. But she said that her blood sugars were easier to maintain and et cetera. And I'm like, oh my God, they're going to take those out of you one day.
Right.
I was like, I'd run away if I was you. Like, I'd be like, I gotta go,
Yeah. So there are times, with Omnipod 5, they let the trial participants get the pre-release. And so there was a, hopefully not too much of a gap for people who did that trial and then got to actually use the product. But for the Afrezza trial, it's a little bit different. And again, it'll depend on your endocrinologist, but my daughter gets this prescribed from her endocrinologist, even though she's 16. And it's only approved for 18 and up. It's an off-label prescription, and they absolutely have the, prerogative to do that. Mankind Corporation, who makes Afrezza, also has a list of endocrinologists who prescribe it. So, you can figure out a way to get it if you want it, even if you're a kid.
Yeah, it's nice. It's nice that you brought that up because, as an example, right now, Omnipod 5's out in the world, and people are like, "Well, it's not approved for my insulin." And I answer as many people as I can. And I say, "Look, not a doctor. I don't work for Omnipod. I
Right.
come from no position of power in this scenario whatsoever. But they didn't test it with your insulin in the FDA trial." They didn't say it doesn't work with your insulin. They say they didn't test it with your insulin.
Yes, exactly.
And then you're like, do you feel the rest of what I'm saying here? Like, because people are like, are you going to use a Pedra in Omnipod 5? And I was like, yeah, that's the insulin Arden uses.
Right.
Yeah. Well, it's not, they said it doesn't work. I'm like, nobody said it didn't work. What they said was they didn't test it. And so it's little nuances of, everybody's covering their, there are people covering their butts legally all over the place. And most people can't hear through the nuance of the conversation. And then they get stuck saying, oh, well, I'm not allowed to do that.
Such an important point. Such an important point with this disease, because we know so much by managing it at home on a day by day, hour by hour basis. We can't. Yeah. And I mean, that's, certain devices are only approved for, the arm, but that doesn't mean they don't work wonderful on the calf, Yeah.
Yes. I've seen people.
No one tried it. No one ran that through a clinical trial. It would be so expensive to do that clinical trial with every part of the body. You just couldn't.
Yeah. Right? Isn't it funny? People are like, well, I need this stuff right away. I'm like, well, every place they test it on, every insulin they try it with is going to elongate the testing process at the FDA and elongate that process. And it's not that it wouldn't work out. It's not that you couldn't, it's not that you couldn't wear your insulin pump on your calf.
Yeah.
It's that the company looked and went, not enough people are going to try this to make it worth the amount of time it's going to take to get through the FDA.
Yeah. And I will tell you, we had the opportunity to try Afrezza without a prescription because someone gave it to us. But then I wanted to get our own prescription so that I could keep getting it because it worked so well. And I switched endos to get it. And, it's not just, yes, I want Afrezza, so I'm going to switch endos, but I want somebody who is going to be thinking a little more flexibly and not going to sort of just put up barriers. So there are some people who will not prescribe something off label, but first of all, I know now Afrezza has been through trials with pediatrics and it's been totally fine. But my daughter's 16. She's the same size as I am. And I'm, older than that. So
Kim,
I'm not worried.
The other day so you mentioned your daughter's cycling through birth control hormone, trying to take care of a problem, right?
Yeah.
So Arden has that issue as well. And, sometimes she still has some sort of residual stuff. We're trying to figure it out still. We're up to the point where she's going to see a GI doctor. Mm-hmm. So we find the best GI doctor we can. Make the appointment. I call up. I say, hey, I'm calling for my daughter. She's a minor. Okay, blah, blah, blah. We get the appointment. We wait 5 weeks for the appointment. She has to take off school to go. My wife takes off work. We all drag ourselves over there. We fill out all the paperwork that the place has. And we're sitting in the outer office. They, Mr. Benner, could you come here for me? I come up to the window. She goes, I'm so sorry. This is so strange. We can't see your daughter. She's a minor.
No.
And I said,
and she's almost 18.
I'm like, yeah, I mean, she's 17, but she'll be, and so literally Arden's going to be 18 in under 60 days. And I said, but she'll be, in under 60 days. It's okay. You can say her. No, we have and so it turns out it's about their insurance.
Of course it is.
Yeah. So they're only covered to help people over 18 years old. And I said, but this is ridiculous. Look at her. She's a lady. You know what I mean? Like she's got all the lady bits and everything. She's totally a lady. And, let's do it. And no, I've gotten a bit of a tussle Kim, I might have been unnecessarily loud. I got upset because Arden's in pain. And they're like, well, call the children's hospital. I said, the children's hospital is just going to go by the book. They're going to tell her she's fine. And then that's going to be the end of it. I'm like, we need you. We need a ninja in there looking around. That's why we're here. We understand. We can make you an appointment for after her birthday.
Oh my God.
I said, but she's going to be in pain between now and then. That's okay with you? Nothing we can do about that. She could go to the children's hospital.
Oh, I'm so sorry.
And they were, trust me, the people saying it, they didn't want to be saying it. They were just following some arbitrary rule that they set up. And now this is how we do it, and blah, blah, blah.
Yeah.
And you're right. You don't want an endocrinologist, as another example, who talks to you that way about diabetes. About like, oh, no, it's not okay, or it's not this, or it's not. I'm like, just, Arden's tried, our endo's been great. Every time we want to try different insulin, I just send them an email. I'm like, okay, can we try Fiasp? Sure, here comes a prescription. No big like, well, we'll have to get you in here and talk to you and run you through the mill. It's just like, yeah, sure, give it a try.
Nice.
It's helpful.
That's not always the case. So that's really nice.
Not at all. I know.
Yeah.
Is there anything that we haven't talked about that you want to talk about?
No, although I think we should connect offline about these other issues that you were at the doctor for. Oh,
because you might have some thoughts, or you're wondering what we found out?
Both. Yeah. Yeah.
Well, why don't we just say goodbye and then we'll talk right now?
Oh, it sounds great.
All right. Cool. Well, thank you for doing this, Kim. I enjoyed having you back again. I hope you do it again.
Yeah, wonderful to be back. I will come back to share other trials.
Excellent. Hold on one second. I have found Kim to be delightful both times I've met her, and I really do appreciate her passion around these clinical trials. If you're looking for that Afrezza clinical trial, I have the link here. I can't read it to you. It is way too long. But I can tell you that I got to it by Googling Inhale 1, that's the number 1, Afrezza. So it's Inhale, classic spelling of Inhale, 1 Afrezza. And you'll find it right there. It's at clinicaltrials.gov. Thank you so much to Kim, and thanks to Dexcom and Omnipod for sponsoring this episode of the Juicebox Podcast. You can learn more about the Dexcom at dexcom.com/juicebox. More about Omnipod at omnipod.com/juicebox. You can learn more about all of the sponsors in the show notes of this podcast player that you're listening in right now, like in your Apple Podcast app or something like that. They have a show notes section. You can find it. Or these links are also at juiceboxpodcast.com. It helps me a great deal if you use my links when you're finding out more about the sponsors. Like, don't get me wrong. If you end up in your doctor's office one day and you're like, hello, doctor, I would like to get an Omnipod. I still feel good for you. I'm super excited about that. But you know what I'm saying? Like, I don't get no credit for that. So use the link, please. Dexcom.com/juicebox, omnipod.com/juicebox. Links in the show notes, links at juiceboxpodcast.com. Got a great episode coming up for you on Friday. Hang out. And what else? Oh, I have that thing about the insulin. Yeah. Oh, I know what I'm going to give you next week. Oh, you're going to love it. Love it. Very interesting thing coming up next week. A number of things. I could look here and tell you. Let me take a look. Like, you know what, though? Why spoil the surprise, right? You just subscribe in your podcast app, and next week the episodes will pop up, and you'll get new ones. That's what I would like from you. If you could just do that, please. To be perfectly honest with you, if you're listening and you're not subscribed in a podcast app, you make the inside of me sad by not doing that. Please don't make me sad. Subscribe in a podcast app. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. Did I do that already? I don't think I did. let's just let it go. If I did it already, then you heard it twice. And I mean, it's a free podcast. Stop complaining.